theory turn
Hi,
off.
good morning or good afternoon, wherever you might be. Thank you for joining us for this ABA seminar, or webinar, I should say, on the 50th anniversary of the Indian Self-Determination and Education Assistance Act. This statute, since 1975, or 50 years, has provided a very unique legal framework for tribes to assume the responsibility and associated funding to carry out programs and services that the United States government would otherwise be obligated to provide American Indians and Alaska Natives. Today, the self-determination and self-governance policies and other legislative initiatives designed along the lines of the Act have proven to be some of the most successful policy that the United States has ever enacted, impacting American Indians and tribal communities. Today, we have a fantastic panel, all people who have been involved deeply in the development initially of the Self-Determination Act and then implementing the Act over the past 50 years. Mary Smith is the immediate past president, American Bar Association. She was the former director of the Indian Health Service for a number of years. She's currently the vice chair of the Venn Group, and she's also the chair of the Caroline and Ora Smith Foundation. Secretary Deb Holland, who is not on right now but should be joining any minute, is the former Secretary of the Department of the Interior. She also was a longtime member of the House of Representatives. I probably don't even need to introduce her to everybody because she is so well known. Bobby Green Kilberg was former White House fellow in President Nixon's Domestic Policy Council. So if there's anybody on this panel who was in the birthing room when the Self-Determination Act was birthed, it is Bobby. Brian Newland is the former tribal chairman of the Bay Mills Indian community. He's the former Assistant Secretary of Indian Affairs of the Department of the Interior. Chairman Ron Allen is the chairman and CEO of the Jamestown S'Klallam tribe, longtime chairman and CEO of that tribe, and he has been at the forefront of the self-governance initiative. He is also not on, but he should be joining any minute. And finally, Natasha Singh is the president and chief executive officer of the Alaska Tribal Native Health Consortium. Natasha has been around the Alaska tribal health system for many decades, and she knows her way around the self-governance program and how it's been implemented in that state. So without further ado, I'm just going to turn it over to our speakers. We're going to structure this so that each panelist is going to spend a little bit of time just talking about their own personal experiences about the Self-Determination Act. And then each speaker will go somewhere between 5 to 8 minutes, somewhere around that. After each speaker has spoken, then we will go into a question and answer period. So without further delay, let's get started. And Bobby, if you wouldn't mind getting us started, that would be wonderful. Tell us where the Self-Determination Act came from.
Absolutely. Can you all hear me?
We can hear you well. Yeah,
okay.
Thank you.
Everybody, thank you for giving us this opportunity to share what we've observed in the 50 years of the Indian Self-Determination Act. I'm sorry, I'm losing my voice. My role is to set the stage, which began with President Nixon in October 1969, and to discuss the dynamics of the president's thinking and goals at that time. As we all know, President Nixon was a complicated person. In the area of Native American rights, he had a very clear moral compass that motivated him to remedy the terrible history of termination and forced assimilation that had dominated the federal government's Indian policy for as long as anyone could remember. Nixon's parents were Quakers and believed simply in equal opportunity. Nixon absorbed that standard and felt very strongly that the rights of Native Americans to pursue their own identity through self-determination was the right thing to do. He attended Whittier College, was on the football team, and was very close to his coach, Wallace Chief Newman, who was an Indian from the Lusano tribe in California. He viewed Newman as a second father and was very upset that Newman was discriminated against because of his race. and firmly believed that he would have been a coach in the Big Ten, but for the reality of being Indian. Nixon vowed that he would change that pattern of discrimination when he became president. I'm on this panel today to discuss President Nixon's effort to return Blue Lake and its 48,000 acres of surrounding watershed land to the Taos Pueblo of New Mexico, 64 years after it was stolen from them by the federal government in a surveying, quote, error. That set the stage for the president's Indian message. The Taos Pueblo had fought to have the lake and land restored to them for all those years, because without it, they could not properly practice their sacred religion. As a Quaker, Nixon was especially sensitive to the need for religious freedom. As a young White House fellow and the only White House staffer with any knowledge or experience with Native American policy through my work as a student at Yale Law School, I was assigned by John Ehrlichman, Nixon's domestic policy counselor, in October 1969 to be the project manager of a comprehensive review of Indian policy, with an emphasis on transforming it into a policy of self-determination, including the return of Blue Lake to the Taos Pueblo people. The result was President Nixon's 1970 Indian message. I need to take a moment to put this message into context and to note that President Nixon was an active domestic policy proponent. I will only have time to list a few of his most important domestic initiatives, but they were profound. 1, a focus on federalism. 2, the beginning of welfare reform that President Clinton was finally able to sign into law. 3, the creation of the Environmental Protection Agency, the EPA. 4, the creation of the Occupational Safety and Health Administration, OSHA. 5, major expansion of the Clean Air Act. 6, establishment of the Clean Water Act. 7, creation of Earth Day. 8, signing of Title IX. 10, the full funding of the newly created endowments for the arts and humanities, which President Johnson had established at the end of his term. Next, the Philadelphia Plan, the first affirmative action program for the construction trades. Then major pension reform called ERISA. After that, healthcare reform, including the creation of HMOs, which were a revolutionary concept at that time. Next, major increases in funding for historically Black colleges, in line with his philosophy of self-determination and opportunity without forced assimilation. Next, creation of the Office of the Domestic Policy Council and the Office of Management and Budget, OMB. And finally, a major increase in the number of women in leading federal government roles. Plus, passage of the Indian Self-Determination Act, followed by the Alaska Native Claims Settlement Act, which redefined Indian relations in this country, recognized tribal sovereignty and self-determination, and rejected termination and forced assimilation in favor of Indian tribes determining and controlling their own future. Richard Nixon believed this to his core. This was a definitive break from the past, and he provided the building blocks to make the policy a reality. With major assistance from the National Council of Indian Opportunity, NCIO, that President Johnson had formed in 1968, and that consisted of 8 cabinet secretaries and 8 Indian leaders, a platform was developed that resulted in final recommendations in Indian policy to the president in late April 97. Those final recommendations were as follows: self-determination with rejection of termination, the right for Indian tribes to control and operate federal programs through contracts, education reform, including the right of Indian communities to control their own schools, economic development legislation, major additional resources for Indian health and urban Indian programs, establishment of an Indian Trust Council Authority, which unfortunately never passed, creation of an Interior Department Assistant Secretary for Indian and Territorial Affairs, and the return of Blue Lake and its surrounding lands to the Taos Pueblo. I clearly remember John Ehrlichman telling me that President Nixon was adamant that no one in Indian territory should ever view self-determination as a disguise for termination. An intriguing question is how and why Blue Lake became the centerpiece of President Nixon's Indian message of July 8, 1970, reported on the front page of the New York Times above the fold with a big picture, with a full inside page as well. Well, it is late June 1970, and is often the case given every president's exceedingly busy schedule. Many major initiatives are announced via a press release document rather than through an event, and that initially was going to be the case with the Indian message. Thus, where is this now? Thus, I haven't lost it. Thus, in late June, last week of June, I'm carrying about 200 copies of the Indian message press release to the White House press briefing room to give out to the reporters. As I walk on the incline down to that office at the end of the West Wing, out of nowhere, I see a guy named Ken Ballou, White House Director of Senate Relations, racing towards me from the Rose Garden. He tackles me with such force that I'm knocked down and all the press releases fly into the air. As Ken apologizes and helps me out, I astonishingly asked him what the heck he's doing. He declares that the Indian message cannot and will not be released. Incredulous, I ask why. And Ken replies that New Mexico senior Senator Democrat Clinton Anderson opposes the return of Blue Lake to Taos Pueblo because of the opposition of ranchers. And he is threatening to vote against the Anti-Ballistic Missile Treaty, the ABM, a really big thing at that time, if the president does not remove Blue Lake from the message. My response was to take Ken upstairs to meet with John Ehrlichman, who listened to him and then called the president's secretary to say he needed to come to the Oval Office to talk with the president about an important matter. John and Ken proceeded to the Oval Office. I was much too junior to be invited in, but I waited in the anteroom. After what seemed like forever, the Oval Office door opened, and I thought I saw the president wink at me. Now, this president was not known to wink at anyone, but I swore he winked at me. I looked at Ehrlichman and Ballou and asked what happened. John was smiling broadly, and Ken looked like a Mack truck had run over him. The president had instructed Ken to tell Senator Anderson, and I quote, this is not my language, it's the president's, this decision stands in support of Blue Lake, and if Clinton Anderson doesn't like it, he could vote against the ABM, and he could, four-letter words beginning with F, himself. And what is more, Ehrlichman said we are going to invite the Taos Pueblo leadership to the White House to release the Indian message in front of them and to declare the president's strong and firm support for the return to Blue Lake and the entire Indian message.
Thank you so much, Bobby. That's a wonderful story.
It is a story, but it's not finished. You want me to stop or keep going?
Well, how about I'll give you another minute. Can you condense it a little bit? This is the worst part of being a moderator, by the way, for everybody out there, because you have to interrupt people to keep them to the schedule. Otherwise, we'll just
okay. Well, very quickly, despite all that wonderful hype, the Blue Lake legislation was stuck in the Senate Interior and Insular Affairs Committee, chaired by Senator Scoop Jackson. In fact, the committee had voted to reject the legislation, which should have killed it, and no piece of legislation in the Senate Interior Committee that had been rejected by the committee was ever gone anyplace else, and that was the end of it until Blue Lake. And what you had, though, was you had Fred Harris, who was the Democrat from Oklahoma, who then became chairman of the DNC, LaDonna Harris, his Comanche wife, and Richard Nixon, that were going to precisely do that, and they were going to pass the legislation. And it was just such an odd threesome. If you imagine Nixon, Harris, and backed up by Senator Kennedy from Massachusetts, George McGovern, Bob Griffin of Michigan, and Mac Mathias of Maryland. It had passed the House earlier, and so what was left really was the Senate. What happened in the Senate was that we called literally every member of the U.S. Senate, and the president joined in those calls. The one exception was Barry Goldwater, who would not talk to any of us. He did take a call from the president, but he would not tell even him what he intended to do. He said, you just have to wait and see. What Goldwater wound up doing was he got up finally and slowly and forcefully declared that after thinking about it long and hard, he was supporting the return to Blue Lake because it was the right thing to do. Now, that was really all I wanted to add, except that on December 15th, 1970, there was a Blue Lake signing ceremony that took place in the East Room of the White House. And it was really a remarkable event. Now, the president and the administration then turned their attention to the major self-determination parts of the Indian message, and that culminated in the 1975 Self-Determination Act. I'll leave it to the rest of our esteemed panels, and I apologize for running over to discuss its impact on Native American tribes up to today.
Great. Thank you so much, Bobby. Brian, I'll turn this over to you next.
Thanks, Jeff. I'll do my best to get us back on track because I know folks want to hear from some of our other really smart people. I want to first thank the ABA and all of our fellow panelists here and everyone here listening. I know so many of you have dedicated years to protecting our right to govern ourselves as Indian people. And so I'm just, this is a nice moment to take stock and be grateful for everything everyone's done. Despite all appearances, I'm actually younger than the Self-Determination Act. But I did grow up with this law. And I think it's safe to say that the policy of self-determination and ISDA are an unqualified success. So I grew up on the Bay Mills Indian Reservation, which is way, way up there. I think even farther north than you, Chairman Allen, not quite as far north as Natasha. And, we're really remote. We're 400 miles north of the city of Detroit. And as a kid, jobs were scarce. People had commercial fishing jobs, seasonal jobs. If you went off the res, there were some state and federal jobs. But there weren't a lot of jobs on the res. In the to late 1980s, Bay Mills tribal government employed somewhere between 40 or 50 employees. And that fluctuated as grant cycles and grant funding came and went. When I was really young, we had an IHS clinic that served two tribes, Bay Mills and the Sault Ste. Marie tribe, off the reservation. And our tribal administration building, which is the same building where I worked as tribal president, was a double-wide trailer that wasn't accessible to people in wheelchairs or others with mobility issues. And at that time, Bay Mills was like a lot of tribes and was adamant that the federal government fulfill its trust obligations through direct services. And just like in a lot of places, it wasn't working very well. So over the last 40 years, Bay Mills, like a lot of tribes, has really taken to self-determination and 638 contracting. And today, the tribal government employs more than 330 employees. It is one of the largest employers in the Eastern Upper Peninsula. It operates professional local government programs that neighboring communities also rely upon. And Bay Mills is also now the leading primary healthcare provider for much of Michigan's Eastern Upper Peninsula, including non-Indians off the res. And our tribe really led the regional response to the COVID-19 pandemic. When I was chairman, we worked with IHS using the 105L leasing program to build a brand new state-of-the-art health facility. The 105L leasing program is built into the Self-Determination Act. We also used, my successor and our tribal council also used that program to build a new tribal administration building, get out of the double-wide trailer and really bring in all the staff under one roof. And if you were to drive through Bay Mills today, you'd see construction crews working on different projects about every half mile through the res. And that's not an exaggeration. And a lot of those projects are there to support 638 related activities. And it's been the Self-Determination Act and the self-determination policy that has made this all possible. It actually reversed the brain drain at Bay Mills and empowered us to be our best selves. After I finished my service as tribal president, I came and worked with Secretary Holland at the Department of the Interior. And I was always impressed to visit tribal communities and just see, how they use self-determination and self-governance to, take care of their needs. Santa Clara Pueblo, for example, with their forestry and fire program, Tlingit and Haida with their work. Chairman Allen's going to talk about his work, but it was really impressive to see, Chairman, how your team has, used healthcare and 638 to really benefit, again, not only your community, but your entire region. Folks at Pasquayaki, I could go on. There's just so many places where people were doing awesome stuff in their communities. One of the things that we worked on when I was serving as assistant secretary was the expansion of that 105L leasing program. So back in 2019, the BIA had only 2 tribes in the whole country using the 105L leasing program in 3 leases. By the time I had left back in January, there was a backlog of more than 1,300 105L leases pending at the Department of the Interior, worth more than $100 million total. Also, one of the things that I want to note is when I first served at the Department of the Interior in the Obama administration, there were approximately 260 tribes that had self-governance compacts with the BIA, and that number is now nearly 300. It's just shy of that. So there's been growth in self-governance compacting. And we saw now some of the growth beyond where self-governance and self-determination have been in the last even 20 to 25 years with things like the Progress Act and the regulations there. The Public Law 477 program, which really takes the spirit of self-determination and expands it to a lot of other federal agencies outside of IHS and BIA. And I'm happy to answer questions about that later, Jeff. But I think one of the key things that I've seen in the last few years is that people are taking self-determination and self-governance beyond BIA, beyond IHS, and really using it for innovative things. And I know Chairman Allen's going to talk about, co-management in 638 and how funding has been made available through other agencies. And that's really exciting to see. And it really, the sky is the limit. And the last thing I'll say, Jeff, is that this trajectory, this growth has been nonpartisan for the most part. And we should not take that for granted. We can stand on the shoulders of the folks who are here and listening in today and be good caretakers of the work that's been done and really take this to the next level in the coming decades. So I'll stop there and toss it back to you, Jeff. Thank you.
Thank you so much, Brian. I really do think that I want to underscore that bipartisanship really has been kind of a key part of it in Bobby's description of who the unusual players were who helped birth this self-determination policy and the Self-Determination Act. The same thing, bipartisanship was in that room, and bipartisanship has been involved in every major initiative involving self-determination for the past 50 years. Natasha, can I turn this over to you next?
Yes, let me make sure my PowerPoint works. Do you see the cover page?
Yes.
Okay, great. So my name is Natasha Singh. I'm from Stevens Village. My presentation will go over the history of tribal health in Alaska, which includes the tribal takeover of the federal program. Okay, next, how do I do the next slide?
Be able to just hit the down arrow.
Down, no.
I'll scroll.
Oh, okay, I'll just scroll.
This arrow.
This arrow, okay. Thank you. Thank you, Chelsea. So first, the tribal health system today serves 170,000 Native people and it's governed by our Alaska Native tribes, and it employs over 12,000 individuals now. Our tribal health system is completely tribally owned. Really, it's focused on local decision-making and flexibility. Our federally recognized tribes and our regional tribal health organizations and the Alaska Native Tribal Health Consortium really prioritize and set our strategic plans and our budget allocations and create our culturally relevant programs. Oops. What did I do?
We just lost your PowerPoint presentation, Natasha. Everybody needs a Chelsea close by.
I've never apparently shared my screen before. I'm lucky that I haven't had to. So first of all, just to make it clear, our tribal healthcare is not free. Tribal nations were forced to cede their traditional lands. And so in return, the United States has a trust responsibility to provide tribal citizens with certain rights and services. In Alaska, after the Snyder Act, the U.S. Public Health Service began providing healthcare in the 1920s, followed by the BIA. In the 1950s, Congress, in responding to the TB epidemic, funded a 400-bed Native hospital in Anchorage. Later in the 1950s, the Public Health Service transferred to the IHS, and the Alaska Area Office was created. This slide demonstrates the federal program and how it was split up into 9 regional service areas. I'm pretty sure it's documented that the yellow region there in the interior is the best tribal region. In the 1960s, the tribes created the community health program. This was really established by our birth workers who continued their traditional medicine, and it developed after U.S. Public Health, BIA, doctors were training our birth workers in other parts of medicine, and there was really a volunteer network kind of became official. And really, still today, our health aides are the backbone of the Alaska Tribal Health System. ANHB was established in the 1960s, and then we had the Indian Self-Determination Act was passed, as well as the Indian Healthcare Improvement Act. In the 90s, an opportunity arose for the tribal health demonstration project. And by this time, our federally recognized tribes has authorized our regional tribal health organizations to implement a lot of programs, create their own programs. And there was a scramble to apply for the pilot program, and the tribal leaders in Alaska came together and said, let's not compete, let's apply all together under one program, under one compact. And that's where we get the one compact today. All of our federally recognized tribes, regional tribal health organizations, and the statewide entity, ANTHC, negotiate with the Indian Health Service under one compact. We speak with one voice. We reach consensus, and it's kind of a difficult process when You're representing 230 federally recognized tribes, different regional tribal health organizations with different priorities based on geography and disease rates, but we get there because we're stronger unified when negotiating with the Indian Health Service. And even though the self-governance program is better than the federal program because we get to set our own priorities, there's still a lot of bureaucracy under self-governance. And when we negotiate in a unified fashion, we're able to implement the self-governance program a little better than if we would on our own, I think. This slide demonstrates all of the co-signers of the compact, and I think the numbers demonstrate the tribes behind that compact. Going back to our timeline, in the 70s, we had Section 325 passed in 1997. This law authorized the formation of the Alaska Native Tribal Health Consortium and South Central Foundation. At the time, the Indian Health Service just built a new hospital in Anchorage, and the tribes in Alaska were looking to really take over that hospital and really take over those statewide services. It's interesting that this law was not really bypassed the regular public process. And this is something we really need to look out for in the future. And Congress just passed it without tribal input. Luckily, the tribes at the time wanted to establish the consortium, but because there wasn't tribal input, the way they split up the federal office, as demonstrated in this slide, in 97, Indian Health Service controlled all of our statewide services, and the Alaska Native Medical Center and South Central Foundation controlled the primary care center and some satellite clinics. But by the time ANTHC implemented the program, we had the Alaska Native Medical Center here split up because of 325 in this odd way. And it's still tedious implementation and really kind of demonstrates, if we had more time, I could talk to the history of ANTHC and South Central Foundation about how we've implemented this section of the law. This slide demonstrates all of those that represent ANTHC and our tribe. This slide represents the fact that ANTHC is a statewide entity. I like to present this slide. It's our referral system up against the continental United States. It's always nice to do that when our friends from the lower 48 are online. Again, the backbone to the tribal health system is our community health clinics. We have 180 village health clinics, over 500 community health aid and practitioners, which also 125 behavioral health aides, 60 dental health aid therapists, and more. So if you're in the tribal health system in a village, you'd first go to a community home clinic, probably seen by a health aide. You might be referred to a sub-regional clinic where you'll have a mid-level provider, maybe get some lab work done. And then you might be referred to your regional hospital. We have 7 accredited regional hospitals, and they're all independently managed by their regional tribal health organization. And if necessary, a patient might be then referred to the Alaska Native Medical Center in Anchorage, which is governed and managed by the Alaska Native Tribal Health Consortium. And ANTHC has community health, environmental health, and Alaska Native Medical Center. I'll just point out that community health services includes our epidemiology center, which some of our research is on the chopping block currently, but this really makes the epidemiology center can really make for true tribal self-governance, where our tribal leaders are looking at their own data and information and are able to strategic plan based on disease rates. They know what's going on in their region and their villages. And so epidemiology is extremely important to the implementation of self-governance. We also have the Department of Environmental Health, where we build sanitation out in our villages. We also took on climate change adaptation recently, and we have published this report. This slide deck will be available after. And then ANTHC manages the Alaska Native Medical Center. It's a 180-bed level 2 trauma center. It has not been expanded since the doors opened, but really learning about the hospital in the past 3 years that I've been here, nowhere else in the country are you able to go to a tribally managed hospital where your specialists are employed by the tribes and they're right there. They're not referred out, and a lot happens at our hospital. This slide provides some of those stats, and this slide really goes through how the tribal health system continues our care. So I hope this just gives you a flavor of what we've been able to develop in Alaska because of our unified voice. And in celebration of self-governance, I think we're obviously better off than we would have if Indian Health Service was developing or implementing their program. But after 50 years, we still haven't, or after 25 years, we still haven't expanded our current hospital. And that's because it's very difficult to implement programs that are short funded and by $60 billion a year. And oftentimes at the Alaska Tribal Health System, we speak in a unified voice to the Indian Health Service, but we're in constant negotiations with each other over that short funding. Thank you, Jeff.
Thank you so much, Natasha. You did an admirable job. The system up there is unique, complicated, and really, I'll just say one thing. It is the only system that's available if you're outside of any of the urban areas. So it provides services not only to Alaska Natives and American Indians, but also to non-Indians. If you happen to be in Bethel or in any of the regional towns, you're going to use the tribal health system. So it's an extraordinary experiment that is working, I think, from my vantage point, just extraordinarily well. Let me turn this over to Mary next.
Well, hello, everyone. It's so wonderful to be here to celebrate the 50th anniversary of the Indian Self-Determination Act. I am so thrilled to be with my fellow esteemed panelists. All of them are such great advocates for American Indians and Alaska Natives, and I've worked with almost all of them. Bobby was there at the inception. I remember my background is I was in the Domestic Policy Council in the Clinton administration, working. Part of my portfolio was Native American policy, and I remember first meeting Chairman Allen, who is a very passionate advocate for Native peoples. I had the honor of working with Brian, and of course Secretary Holland is so amazing and a champion for all of us. And Natasha talks about everything in Alaska, and I later was CEO of the Indian Health Service. And I made it a priority to visit the incredible system that the tribes have built up in Alaska, including visiting, remote villages like Chivak and the regional hospital in Bethel, and of course the main hospital in Anchorage. And it's incredible. Thanks so much to Natasha and everyone's work up in Alaska. And Jeff and I known each other for a long time. And actually, while I was CEO of the Indian Health Service, we actually negotiated a lot of the contract provisions in the self-determination contracts with the tribes. And I personally led those negotiations. It was important to me. So Jeff and I have spent hours upon hours together in conference rooms doing that. So it's so great to be here. And, I will also note that not only is this the 50th anniversary of the Indian Self-Determination Act, but it's also the 70th anniversary of the Indian Health Service. The Indian Health Service was split up from BIA in 1955. So there's 2 anniversaries this year. So what I thought I would do during my remarks is kind of talk a little bit about where we've been, set the act in context, and talk a little bit about the amendments, a little bit about my experiences at the Indian Health Service and the transformative nature I've seen through these self-governance contracts, and then a little bit about what may lie ahead. And I know some of the other panelists are going to address that too. So with that, I'll talk about we've been talking about the Indian Self-Determination Education and Assistance Act. And that act was passed in 1975. And you'd say, why is that time frame relevant? Well, many of us remember, some of us have only read about it, I'm sure, the civil rights era in the 1960s, the era of the Voting Rights Act, the era of Martin Luther King. But what you may not realize is that the early 1970s was also an era for American Indian civil rights. And in fact, the Indian Civil Rights Act was passed in 1968. So a few years later, the Indian Self-Determination and Education Assistance Act was signed into law. And this law reversed a 30-year effort by the federal government under its preceding termination policy to sever treaty relationships and obligations to Indian tribes. It was the result of many years of change influenced by American Indian activism, the civil rights movement, and frankly, just grassroots political participation. So in enacting this law, Congress recognized the importance and frankly, the paramount nature of tribal decision-making in tribal affairs and the importance of the government-to-government relationship between the United States and tribes. And it recognized that tribal leaders and their citizens are in the best position to understand the critical needs and priorities of their communities. And we've heard from Brian the number of self-determination contracts that are at the BIA. In fact, the original law passed was Public Law 93-638. And those contracts are still called 638 contracts. So in terms of the law, it was passed, and there were some major amendments in 1994. So they amended the act to add a number of provisions, and they included a new Title IV, which implemented a permanent tribal self-governance program within the Department of the Interior. Before that, it was not a permanent program. And also in 1994, they created Title III. And Title III was formerly a self-governance demonstration project for both IHS and Department of Interior, and it became limited only to the Indian Health Service. So in 1994, self-governance contracts at the Indian Health Service were still in like a pilot phase. So in 2000, the amendments of 2000 made the self-governance demonstration project in Title III a permanent program within the Department of Health and Human Services. So the 2000 amendments repealed Title III and enacted 2 new titles, Titles 5 and 6. So Title V established a permanent self-governance program within the Department of Health and Human Services for Indian Health Service. And so those are called Title V contracts now. And Title VI, which authorized a study of future inclusion of non-IHS agencies within the Department of Health and Human Services. You can think of things like SAMHSA, which is the Substance Abuse and Mental Health Programs. Like looking forward, maybe those could be taken over by the tribes. So it's been quite a journey. So let me just explain, and Brian addressed this a little bit, and so did our other speakers. What happens when a tribe decides to exercise their rights of self-determination? So under Title I of the Indian Self-Determination Act, a tribe may decide to enact not their entire health system, but just certain programs, like some substance abuse programs might be an example. Under Title V, they are taking over the entire program. So I'll just use an example from Oklahoma. I'm a citizen of the Cherokee Nation. There's a hospital on the Cherokee Nation, was originally built. It was run by the Indian Health Service. At some point, the Cherokee Nation wanted to exercise their rights of self-determination. So they decided to negotiate with the Indian Health Service and take over the hospital. So what happens is there's negotiations. All the provisions are written into contracts. The Indian Health Service still pays for the funding that would have flown to the tribe. And then all the employees that used to be federal employees, they become tribal employees. So it's quite a process. And similarly to the Bureau of Indian Affairs, which Brian addressed, today, over 60% of appropriated funds at the Indian Health Service are a pass-through. They flow through directly through the Indian Health Service and go directly to tribes to exercise their rights of self-determination under these self-governance contracts. The Indian Health Service still directly runs certain hospitals and certain clinics. And so in the Indian Health Service, you have direct service tribes where the federal government is still running the health systems. And then you have the self-governance tribes where the tribes are running those systems. There are 12 areas across the United States. The Alaska area is one area. Basically, the Nashville area is everything east of the Mississippi. Both Alaska and the Nashville area are completely self-governance. Some of the areas that are still somewhat direct service are the Navajo region, the Billings area near Montana, and the Great Plains. So we still see, and the one thing I want to emphasize is that it is a tribe's right to decide whether they want to exercise their rights of self-determination, but they have an equal right to stay letting the Indian Health Service run the programs. So it was quite an honor. And I visited so many health systems when I was head of IHS, and it was simply, Natasha talked about it in Alaska. It truly is transformative. What the health systems with the community health aides, Natasha talked about the health aides up in Alaska. I visited the dental health aides. They have a huge dental health aid program in Alaska that really has been transformative for dental health. In Oklahoma, 3 examples are the Choctaw, Chickasaw, and Cherokee nations are essentially running regional health systems. Sure, they serve the citizens of each of those nations, but they're serving anyone in that region. And in fact, the Cherokee Nation recently has partnered to create a medical school. So it's really been exciting. So just looking ahead, we say, where do we go from here? And I would say that one thing is, as happens with laws, those things get litigated sometimes. And a lot of these self-governance contracts get litigated in terms of reimbursement from the federal government. And I'll just cite last year, there was a major case with Becerra that went up to the Supreme Court. And one thing that people may not realize, the Supreme Court takes very few cases, but usually every term there are some Indian law cases. And so last year in Becerra versus San Carlos Apache, the Supreme Court upheld the very essence of the Indian Self-Determination Act and allowed tribes to collect administrative costs from third-party revenue streams like Medicare and Medicaid. And Justice Roberts, this is the Chief Justice of the Supreme Court, he said that ISDA was intended to provide, and this is a quote now, an effective voice in the planning and implementation of programs responsive to the true needs of their communities. So it was a penalty for tribes if those costs were not covered by the federal government. So, in Indian law, those of us who practice in Indian law, sometimes there are major victories, sometimes there are a couple steps back, but we're going to keep pushing ahead. And I think I just wanted to end on a quote from another case. When the Secretary Holland was secretary, was the Brock King case involving the Indian Child Welfare Act. And even though that case doesn't involve the Indian Self-Determination Act, there's a powerful quote in that case from Justice Gorsuch, which I think applies in this case as well for tribal sovereignty and tribal self-determination. Justice Gorsuch, in reference to the Indian Child Welfare Act, he wrote that in enacting this law, and I think it's applicable to ISDA too, exercised its lawful authority to secure the rights of Indian parents to raise their families as they please, the right of Indian children to grow in their culture, and the right of Indian communities to resist fading into the twilight of history. And I think ISDA has really done that for tribes. So thanks, Jeff. Just wanted to give a little look back and look ahead.
Thank you so much, Mary. That was wonderful. Chairman Allen, can I turn this over to you next? Maybe, maybe not.
Yeah, my apologies, Jeff.
No,
I
perfect.
find the mute button. I just want to say thank you to those who have invited me to be a part of this illustrious panel. Quite frankly, I know everybody on here, and I had deep appreciation for each and every one of them. Bobby, I heard about you, and I always remember exploring what happened back in the Nixon days when the unfolding of the Indian Self-Determination Act happened. So my contribution to this conversation is going to be more about self-governance. But I started in 1974, so I've just passed 50 years on my council and chairman of my tribe, and have been involved with the whole, I guess, the evolution of the Indian Self-Determination Act as it has moved through its journey to strengthen and empower the tribe's sovereign authority and governance. So it's been a fun one, and I learned early on in my career from mentors who I deeply appreciate. Joe De La Cruz, who from the Quinault Nation, who we always reference as the father of self-governance, and Roger Jourdain from Red Lake Band of Ojibwe, and Wendell Chano from Mescalero Apache, a lot of warriors of the past who always table thumped about their rights, their sovereignty, their treaty rights, their standing as governments in the family of American governments. And so it's been a fun journey for me, and in terms of moving this agenda constructively forward, as tribes have separated themselves from, or are separating, in large part, from any dependency on the federal government. I've always believed, based on the guidance that I've received over the years, that tribes will never release the federal government of its duty and trust obligation to Indian country, all 576 Indian nations. helping us get back on our feet as sovereign nations. So for me, it always has been a journey of nation building. I've always appreciated people like Joe Calt and Steve Cornell and Jonathan Taylor. Not Jonathan Taylor. Jonathan Taylor. I'm sorry. Who have written a lot of literature about how tribes should take command over their role. Um, you know, I guess for me, the journey is about how tribes, large and small, can take command over their own affairs. In self-governance, I happen to be honored to be with the leaders back in the late 1980s when it unfolded over all the outrage over fraud and abuse of federal mismanagement of Indian affairs in all the hearings that took place in Sid Yates' appropriation committees or the Senate Committee on Indian Affairs with John McCain and Senator Inouye and others. And so the question of the day was if 638 didn't work, if the management of Indian affairs by the BIA and IHS wasn't working, what should work? And I want to remind people back in those days, when they were trying to rethink self-determination for Indian country, it was, well, let's just figure out how much we spend on Indian country, divvy it up by tribal citizen, and we're done. And we said, absolutely not. That is not how this is going to work. To the credit of the leadership and the legal counsel that has evolved in Indian country, we reshaped how this relationship was going to move on. So self-governance emerged out of, like Mary said, Title III is the basics of it, but Title IV, Title V, and Title VI basically gives you a template, a roadmap of where we're going. We've always said that we want to take command of any Indian program that serves Indian country by the federal government, but we can do it better. Transfer those functions, those services, those activities over to the tribes. And we believe we can do that. My tribe, as a small tribe, had to fight to be a part of the original 8 back in 1990 and 92, and we did. So Brian and others have mentioned, like on healthcare, we're a small tribe, 500 tribal citizens. Our healthcare, our primary care, our dental care, our substance and opiate abuse treatment center, our 16-bed inpatient mental and behavioral health serves the whole community. So we serve well over 20,000 people in our community, and so we're a bit of a powerhouse in healthcare. But it's bigger than that. And I definitely do a shout out to Brian as a former chairman and a former secretary, Deb Holland, who I just adore in terms of her leadership. We made a lot of progress. We made a lot of progress over the years, but this last 4 years under their leadership, we really made some amazing strides moving the tribe's agenda aggressively forward. So, for the BIA and the interior side, it is all about governance. It is all about economic development. It is all about transportation, social, and service community programs. So, and now my tribe said, and to the credit of Deb Holland and Brian, we took over a refuge from Fish and Wildlife. So it wasn't just about BIA. It was other programs that are in the interior that we want to take over that affect our interests and our rights. So we're showing amazing success as we continue to grow. And it just shows that as governance. So Kevin Gover, a former ASIA for Interior, one of the things he always said, one of our roles was to get the federal government out of our affairs. And that was a big agenda, and build up what we call our political legal infrastructure so we function effectively as government. And that is happening categorically across Indian country. And so it just shows that we make a difference in all of our communities. I have a small tribe, but I employ now well over 1,100 employees in our small rural community. And, we make a huge difference in the local economy. So for me, it's always about self-governance, self-reliance. be less dependent on the federal government and other governmental sources, and be dependent on your own resources. And Sid Yates used to say to Joe Dela Cruz and me and the others, how are those independent tribes doing? And we're doing just fine. We got a long ways to go. Success breeds higher expectations. We understand that. We know that our community has great needs. So that's just a reflection of one tribe of many who are reaching out and taking the Indian Self-Determination Act to the next level. Thank you, Jeff.
Thank you so much, Chairman Allen. Secretary Holland, can I turn to you next?
Okay, so the first thing you're supposed to do is unmute. That's not always helpful for me. Anyway, thank you so much, Jeff. It's so nice to see you all. Thank you, everyone, for your leadership. I'm honored to be on this panel along with you. And I'm so honored to share a few words at this important 50-year celebration of the Indian Self-Determination and Education Assistance Act. The law itself has changed the game for tribes, as you've heard. And for over 50 years, it's been such an important tool to advance tribal sovereignty and empower tribes to make their own decisions, to do the things that they need to do. Each tribal nation should have the resources, technical assistance, regulatory frameworks, and funding to pursue practices that align with its own principles. They should be able to think big and make life better for their communities. When I was a tribal administrator for San Felipe Pueblo, we worked on a bridge project. And every step of the way, we were met with obstacles. Barriers like finding matching dollars made it difficult to get that and other projects done. I'm of the mind that the best solutions for each community comes from the community, from the people who live there, who understand their traditions, who have a vested interest in the success of their people. And ISDA's goal is to ensure tribes can do just that. Self-governance has been extraordinarily beneficial for tribes to manage successful programs with the flexibility to use federal funds in a way that best fits the needs of their communities. And as we know, and as Chairman Allen just stated, tribes are their own best stewards. However, over the course of decades, serious gaps have persisted or emerged that hinder the full exercise of tribal self-governance. And that's why I worked very hard to pass the Progress for Indian Tribes Act when I was a member of Congress. That bill bolstered the ideas embodied in the ISDA and enhanced them. It streamlined the implementation of tribal self-governance authority. And then as Secretary of the Interior, I had the opportunity to implement that exact bill that I worked to pass and get signed by President Donald Trump. Yes, I know, that's surprising, especially now that we've seen this administration outright ignore and even sometimes attack tribal sovereignty. Throughout my journey from organizer to Congresswoman to Secretary of the Interior to now running for governor of New Mexico, I've witnessed the transformative potential of what we can do when we empower tribes. And we need to keep the pressure on to do away with archaic practices that hinder progress or were developed to keep us down or even in a box. That's why I've taken a brief pause from the campaign trail to speak with you all today. Today, we're up against forces that will undo that progress and take us back decades. And I know that the lawyers in this room are already planning out legal strategies to protect tribal self-governance, ISDA, and the Progress Act, and to ensure future generations continue to benefit from the solutions that our communities need. Solutions that are of our communities and for our communities. And that's why we do this, because future generations are always depending on legal structures that will protect everything that we have fought for, that our forebears have fought for, and that we're still fighting for. Our cultures, our languages, our ability to pursue our own economic development and our own ways of life. It will continue to take all of us, but together, I believe we have the power to shape a sustainable system that honors our values and protects our future. I'm so happy to be here. Thank you all so much for having me. And back to you, Jeff.
Thank you so much, Secretary Holland. And thanks to everybody on this panel for your presentations. I'm going to turn, we've got about 15, 20 minutes left, so I'll turn to some of the questions. There are several questions that have been asked that focus on what this administration is currently doing with respect to cutting staff at BIA and cutting staff or limiting staff at IHS, and then proposing budgets that are much smaller for Indian Affairs than the past number of years have seen. And the questions really revolve around what those kinds of proposals and actions impact on tribes that are exercising their self-determination and self-governance rights. What will the impact be? And I think I'll add on a question: how can tribes try to prevent those impacts from happening to their programs? And I don't have a specific order that I was thinking of asking, so I'll just open it up, and any of you who feel like you want to contribute an answer to that little bundle of questions, please go for it.
Jeff, I'll just share a really brief example of how staffing cuts affect all this stuff. So when you take the 105L leasing program, we need to come up with better names for this stuff too, by the way. But that leasing program, which is part of ISDA, I'd shared there were over 1,000 lease requests of the department toward the end of last year. That was all centrally managed at the Department of the Interior, and there was a staff of about 5 people who were responsible for processing those leases and then getting the funding out. And at least 2 of them have left the department. And so as you reduce staff to process these, the line just gets longer, and you're trying to move more water through a smaller hose. And so what that means is that the tribes that need to build new clinics, the tribes that need to build new administration buildings, new transportation buildings, you name it, they have to wait longer for those funds, which means you have people in our communities who are, waiting and using many times substandard facilities to do important government work. And that's just one example of how staffing cuts have real effects on people's lives out in Indian country.
That's a great example, Brian. Anybody else want to chime in?
No, if I might jump in, Indian country today is stronger and smarter, more politically effective than ever before. We've been through many battles of similar challenges like this one. And so what we are doing is we are gathering together and shaping the narrative. We are not the problem. We are the solution. And Indian country, for the most part, is in rural America. And rural America has to be healthy. Rural America has to make a difference with regard to the strength of the economy. If we're doing our job, then America is doing its job. And so it's the narrative that's important. We will always continue to remind the decision makers for Congress and the administration of their legal, trust, moral obligation to Indian country. We always will do that, and our whole lives are about education about Indian country and our role in our society. So it is controlling the narrative. I have great confidence that we will push back. Will we have some setbacks? Yes, and we're better prepared. Some of our sister tribes are going to have greater challenges than some. Some are in a stronger position in their governmental standing and their self-reliant capacity. But we rally around each other, and we will help each other through these turbulent and uncertain times.
Good words, Chairman. Go ahead, Mary, please.
Yeah, well, I'll just say, just even looking at the Indian Health Service and BIA. So the Indian Health Service is one of 3 health systems that the United States government runs. And so you are providing direct patient care to patients. So if there are funding cuts, that is felt directly. Similarly, BIA runs, Bureau of Indian Education runs schools. So I know some of these recent cuts, kids arrived at school and their teacher had been let go. Indian children deserve better than that. So I think, as Chairman Allen mentioned, I think Native people are resilient. We're still here, and they have gotten better at lobbying their members of Congress. I think the answer is to use your voice, because there have been triumphs in the past. Like during COVID, the tribes really, and Jeff was part of this, lobbying Congress so that tribes could get COVID funding directly. And they were successful ultimately in doing that. And just last week with the big, beautiful bill, this probably didn't get a lot of press nationally, but I'm sure in Indian country it did, at the last minute. And this was partly through the urban Indian health advocates and others, for the reduced eligibility for Medicaid expansion. There's exemptions for Native Americans. There's exemptions from the work requirements. And how did they get that? Native Americans lobbied their members of Congress and told them why it is critical and life-saving for them to receive health care like every other American. And so I would say use your voice. Native people are resilient, and we need to keep working at it. And it won't. The road ahead won't be easy, but I have confidence in our tribal leadership, our tribes across the country.
Thank you.
Because your voice does make a difference.
Yeah, thank you very much, Mary. Any other comments on that question? Okay, let me ask another question. We still have a few minutes. If all of you were to look in a crystal ball and kind of look at what self-determination and self-governance would look like in 5, 10, 15 years into the future, what do you see?
Well,
I
I see.
didn't
Go
think
ahead,
I could stump you, Chairman Allen.
Brian, go ahead, jump in.
Well, thanks, Chairman. I was going to say, Jeff, I think first it's important that as we move through time, that we make sure people understand some of the things that Bobby was talking about at the beginning about how this came about and why it's necessary. In my tribe, for example, at home, I'm constantly correcting people who refer to these funds as grants. Even our own tribal members, they say, "Oh, we get too much. We rely too much on grant funding." And I emphasize that self-determination funding is not grant funding. It's money that's owed to us. And it's owed to us for all of the lands, all of the blood, all of the lives that were spent, and everything that Indian people have given to create the United States. And it's never been paid in full. And so we should always make sure that we are characterizing this properly as a function of the United States trust obligation, not only to tribes, but to every Indian person. And so to make sure that this continues on a good trajectory, it's important that folks understand that that's what that funding is for. Because if we turn it into a partisan issue and it becomes viewed as grants for those brown people out in rural America, then it's so much easier to take it away. And so I think, where will we go? I think tribes have shown, we've proven that many times we are better at local governance than our neighbors. And people come to rely on us for those services they don't get from the cities and the counties and the townships. If we protect our space to do that work, we'll prove that we're awesome. that we're really good at this stuff. But it is important to protect the space for that to exist, and by making sure that we don't ever let people forget why it was put in place to begin with.
Thank you, Brian. I see your hand up, Secretary Holland.
Thank you. Thanks so much. So I always say this when I'm on a panel or somewhere. We need more Native Americans in public office. I say that often, right? I was in Congress when Chairman Allen was advocating for the Progress Act, and he is relentless, and I love that about him. But who did he come and advocate to? Me as one of the first 2 Native women in Congress. We need more Native American folks to step up and run for public office, because we need more of us at decision-making tables. And so I will just say, in my current effort, right now, running for governor of New Mexico, I'd be the first Native American woman governor in the history of our country. And really, states have a lot to do with with how tribes move forward. It's important that states have relationships with their tribes in their states. It's important that states are partners in economic development and healthcare and education and all these other things. That happens because governors or folks who are in state legislatures or in county commissions or city councils or any of those positions understand the value that tribes bring to the table, and they are willing to build those relationships and ensure that they are actual partners moving these issues forward. So I will say that maybe in 5 or 10 years, that we might have the first Native woman governor in our country, but we also might have more Native folks in office in Congress, in the U.S. Senate, perhaps from Minnesota, that we'll have more Native folks who are able to understand, right? When Chairman Allen comes to my office when I was in Congress, he doesn't have to start at the foundational level and explain to me what tribal sovereignty means. He can just go straight in and advocate for what he wants, right? We need to be at every decision-making table. And so I think that we will be there. With everyone's support, we'll just keep moving our folks forward.
Well, and I'll make a pitch. I was the first Native American woman to be president of the American Bar Association, and we need more Native Americans to be lawyers. How did we get those victories in the Supreme Court? Lawyers brought those cases and got contract support costs for tribes. In the past 10 years, there really hasn't been an increase in the percentage of Native lawyers in the legal profession. And as it stands, the number of Native Americans who are lawyers are 0.5%. That's 0.5%. It's less than 1%. So I encourage all of you out there watching, talk to younger people, encourage them to go to law school. And I would also encourage you, since you're all on this webinar, join the American Bar Association, join the section of Civil Rights and Social Justice, because frankly, this section has been the heart of Native American policy at the American Bar Association. We've adopted as policy the Tribal Law and Order Act, funding for tribal courts, and in the Indian health sphere, advance appropriations, which isn't included in the current administration's budget. And what is that? If there's a government shutdown, federal agencies cannot spend dollars that are appropriated. If there's advance appropriations, they can continue spending the money. And when you're running schools and hospitals, you need to be able to access those funds. So the ABA supported advance appropriations for the Indian Health Service, and they've had a number of policy areas that have been adopted as official ABA policy. We adopted policy on missing murdered Indigenous women, and then we were able to lobby Congress on those acts. And so we got the Not Invisible Act, helped get the Not Invisible Act and Savannah's Act passed. So go to law school, join the ABA, and continue to advocate for Native people.
I would just like to add one thing if I could, and that is back in the old days of 1969, there were only 10 Native American lawyers that were identifiable in the United States. There were others who were Anglos who were dealing with Native American issues, but I just concur with what Mary says so importantly. Obviously, there are many more now, but there are not enough.
Well, I guess my response to that question, Jeff, is I agree with all the comments by the other panelists. And we are doing a lot better at educating our youth in all fields that the spirit drives them. It doesn't matter whether they're lawyers or administrators or nurses or construction people. They're leaders in wherever the spirit takes them that helps elevate their own standing, but us as tribes as well, if they are willing to contribute to our journey as tribal sovereign governments. We're 5 and 10 years from now, more tribes are going to be more self-reliant. They're going to be stronger governments. We know how to deal with these political challenges that we're experiencing right now. We had 4 years, which we got a lot done because we had the right kind of leadership, and that's because of what Devin and others have already said. So where are we? We're getting better. If you look back where we were 20, 30, 40, 50 years ago, we are so much stronger than ever before. We are so much more organized than ever before. Joe Dela Cruz used to say they used to refer to us as Fort Indians, waiting outside for the blankets and the cheese. You know, that's not who we are anymore. We know what we're doing, and we're effective at it. And those who aren't as strong as some, we bring them with us. And we teach them how to be more effective at all levels. The old days, like Bobby was saying, touching on, we had this linear relationship: tribes, federal government. We are now, because of the sophistication of our growth, we've played this multi-layered chess game at all levels of politics, at all levels of the relationship of how complicated our society is, to the international level. So I just think 5, 10, 20 years from now, the Indian country is not going to be recognizable from what everyone saw in 1974 or 1934 when the Indian Reorganization Act was passed, or 1924 when they finally gave us voting rights. Right? So we're going to survive. Our indigenous people are in a survival mode, and I think a lot of that it drove the policy people that Bobby was referring to that started this movement.
Well, and I saw a question in the chat from a law student, and I always like to help law students out. And the question was, I'm a 3L, where can I apply for clerkships that focus on tribal law? And I'll say a couple things. One, thankfully, we have gone from like 0 to 7 federal judges are now Native American. Now, they're not dealing exclusively with tribal law issues, but that would be an opportunity to clerk for a federal judge who's Native American. There are also over 300 tribal courts in the U.S. Over 300 tribes have tribal court systems and applying to tribal governments. So there are a lot of places. I know that I think the Native American Rights Fund lists job opportunities, as well as there's a weekly blog, Turtle Talk, as well, that lists job opportunities. So those are some ideas, and wishing you the best with your legal career.
Thank you, Mary. And thank you, Mary, for doing the pitch on the ABA membership that I was going to do towards the end. I've been involved in the ABA now for, I don't know, a couple decades, not as long as you, but it has been very rewarding to be able to address a lot of the issues that you raised that the ABA addressed. And we also had the privilege of filing the first ABA amicus brief in the Brackeen case that was ever filed in any Indian case pending in the Supreme Court. So the ABA is really doing some good work and important work. Unfortunately, we are just about at the end of this webinar. Thank you all so much. All of you are very busy people, and I appreciate you all taking the time to join this panel, but I also appreciate all the attendees taking the time to listen to all of you share your wisdom and experience on these important topics. This presentation will be available by on YouTube, I believe, at some point here very shortly for any of your friends who didn't see it, or if you want to forward it on to folks you think should see it. But that concludes our webinar today. Thank you again all once more time for taking the time to participate in this. I think it's been very valuable.